afternoon, everyone. It's a pleasure having us here. Join us on this webinar today. Happy New Year. And it's not too late to say yes, that we are grateful to be here. All right, so good day, everyone. Good morning, good afternoon, good evening from wherever you're joining us from. It's a pleasure to welcome us to yet another webinar of the Yaba Voice. The Yaba Voice is the official online voice of the Federal Neuropsychiatric Hospital that aims at providing quality mental health information to the public. And it's also, like I said earlier in the year, to say compliment of the season to everyone. And we're grateful that yet again, we're here in the year 2021. 2020 looked like a very long year. It came with the pandemic, came with the protests, and quite a lot of issues ravaged that year. But yet, like I said, we are grateful to be here. We're grateful that you're also joining us on this webinar once again. So it's good to see you. It's good to see you. Denise, yes, thank you. So many people have said Happy New Year and good day to us. So we're happy to see you here today. Today we'll be continuing with something that started in the year of 2020. It has lingered throughout the year, and then it also had continued again even to the year 2021. And we're talking about the COVID-19. It's going to form the bulk of our discussion today. But to welcome us formally and officially to this webinar, the first in the year 2021, is the medical director of the Federal Neuropsychiatric Hospital and also the chief host of the Yaba Voice webinar, Dr. Oluyemi Ogun. Over to you, ma'am.
Good morning, ladies and gentlemen. Good afternoon, good evening, from wherever you are all over the world. I'm happy to welcome you to this webinar, the first in the year 2021. And I say Happy New Year to each and every one of us. Today we are talking about second wave of COVID-19, the frontline workers' experiences and psychological tips. And let me remind you that on 17 December 2020, Nigeria recorded 1,145 new cases of COVID-19 in one day. This was far more than what was earlier unrecorded. And this led to the Presidential Task Force on COVID-19 to announce that Nigeria had entered the second wave of COVID-19 infection. And this led to measures like warning religious organizations against mass gathering at that time of the year, advices not to travel for Christmas celebrations, and other measures to curb the increase. What is known is that this second wave is far more dangerous than the first one. Reports from hospitals across the country show that more patients need oxygen and more bed spaces are needed than in the first wave. Nigeria has lost many high flyers in the society to COVID-19, as it has also lost others that are not regarded as far-flying, but who were and are still very important to their families. May God, in His infinite mercies, grant each of our compatriots eternal rest. When coronavirus pandemic started early in 2020, experts wondered if there would be waves of cases, a pattern that was seen in other virus pandemics. It was later realized that the decline in infection rate that was noticed earlier on had been erased, and that what was being observed was a higher increase in the number of cases. And this was not peculiar to Nigeria alone, it's all over the world. Because of the second wave has been largely blamed on human behavior, the federal government, states, local governments, and individuals differ in their responses to the pandemic. Some follow the COVID-19 precautions, such as physical distancing, hand washing, and wearing face masks. Others do not follow these procedures or restrict certain high-risk activities like our Owambe parties. While COVID-19 precautions were enforced in some places, others believe it is a matter of personal choice. So what is our collective experience about this second wave of COVID-19, especially the experiences of people that manage the sequence, those who have seen people who fought COVID-19 and won the battle, and also seen those who were not so lucky. We call them the frontline workers. They are those at the COVID-19 battlefields. To share their experiences with us are three experts. The first person, Dr. Charles Ume, is a noble of the hospital and a friend. He's a senior lecturer and clinical psychologist at the Lagos University Teaching Hospital. He's been involved in psychological treatments of people with infectious diseases like Ebola, and currently is the deputy head of the Lagos State Psychosocial Response Team for COVID-19. The second speaker is Dr. Opawoye. He's a senior registrar in infectious diseases units of Lagos University Teaching Hospital. He is the PRO of the Nigerian Infectious Diseases Society. He has extensive experience in outbreak responses, having been part of Ebola, Lassa, and yellow fever responses in Nigeria. He's currently the Infections Prevention and Control Team Lead in Lagos COVID-19 response. It teaches and promotes non-pharmacological interventions of infectious diseases in all the sectors of society. He has set up and monitored isolation centers. He has trained thousands of individuals on infections control across various strata such as health workers, oil and gas, airlines, hospitality, and schools. He has managed hundreds of COVID-19 patients in various isolation centers. The third person is Mr. Charles Ogutade, who is a registered nurse and a registered psychiatric nurse. He's a Yaba boy, having left Federal Neuropsychiatric Hospital Yaba, Lagos as a nursing officer, relocated to Australia where he had a Master of Science degree. He's now a credentialed mental health nurse at the Goulburn Valley Health, Victoria, Australia. He leads a team of clinicians that work in the front line, where their role is to provide clinical screening and assessments at the emergency department. Ladies and gentlemen, viewers at home, please relax and listen to our experts as I hand you over to our moderator, Mrs. Oluwakemi Akintoyeshe. Thank you very much.
Thank you so much, ma'am. The medical director would wet the ground and your appetite will just be overflowing. And you know, what we're looking at might look very trivial. To the normal man out there, they don't even believe that COVID-19 is in existence, not to even talk of the second wave. And this is quite challenging to our world because that means the precaution and everything that we should take would not be taken. All right, so now we would also go on. We have just 1 hour to do this, and we will try as much as possible to maximize the time so that we get adequate benefits and information that would enrich our life. Dr. Pawoye is here from LUT, who is going to share with us, first of all, what COVID-19 is. The layman doesn't understand. Is it in the blood? What is it about? What are the symptoms? You have had first-line experience with people who have had this virus. So what is it that we need to know about the COVID-19 in itself? Thank you, sir. Hello, Dr. Pawoye, please unmute yourself. A signal has been sent to your phone. Can you see? Dr. Pawoye? Okay, while we wait for him to come back, please let us know, sir, when you reconnect back to us. Let's go to Mr. Charles Oguntade. Mr. Charles Oguntade, like you've been said by the medical director, is outside this country. And so we want to hear what's been happening out there. What are his experiences? What have you seen? And most especially with the second wave. And what do you do differently? Maybe we'll also take a cue from that and be able to also prevent and also preserve ourselves. All right, so Mr. Charles Okuntade, please, let's have you.
Yeah. Good morning or good afternoon, everyone. I'm so glad to be here today. It is 11 minutes after 10 p.m. in Australia, and it should be 11 minutes after 12 noon in Nigeria, I believe. It's so glad, I'm really so glad to see a lot of names on the list of people that I've met before many years ago. I left Yaba in 2005. And I could even see people that have left before me that I still catch up with them around the globe. I can see Mr. Yekin on the screen there. You're welcome. He's someone that I really cherish so much. So without saying so much, I'm so glad to be here. So we'll be talking about COVID-19. It has been a information has been a big news all over the world in the last 1 year now, and I always tell people it is COVID-19 is one pandemic that has humbled the whole world. And when it's all started, we thought it's something that's just going to be for a short while, and then we'll move on. But then here we are, it's still with us. I'm just going to talk mainly about the experience here in Australia. If initially I was thinking that I'm going to share a slide, but then I decided not to do that since I've only just got 7 minutes to talk. We recorded the first case in Australia around mid-February in 2020, and this came from some cruise ship that came from Europe and landed in New South Wales, Sydney Harbour, and it was really mismanaged. It was a real debacle, and since then the case we've been having one case or the other, then we have a community transmission, and things started spreading from there. And some state manage it very well. I think my state in Victoria was the most hit in terms of the first wave and the second wave. As of today, Australia has a total case of 28,721. Out of those cases, they've recorded a recovery of 25,919 people and a total death of 909. And when you look at this figure and you compare it to what is happening in Europe, across Europe, in North America, and even in Southeast Asia, you agree with me that is a very small number, but nevertheless, one death is just too many. What will have be a good news for everybody is not to record any death at all. And and when you look at this figure, in when we had the first wave of COVID-19, Australia has a total death of 27 for that first wave. And by May, June, we had a period of days, weeks of zero transmission, zero community transmission. And by July, we entered into the second wave. And when you now look at this figure, now we have a total death of 909. The second wave came with a serious bang. Everybody really felt it. And the death rate jumped from 27 to 909. You can see how bad it is. And the ways that the state the national level, at the state level, at the local level, they just have to seriously collaborate together and see how best to manage these. And the first things which is universal is the social distancing that is very common everywhere. And everybody maintain a social distancing. They recognize services that could be run from home. Most services have to shut down. They're running their services from home. When you look at this, it could be easier for a government to run the services that people will still get paid. But how do you manage individuals that run their own business, the sole traders and all that? But what the government did was that they organized what they call a job keeper, and which they allowed the sole traders to let go their staff and allow them to work from home, but at the same time continue to pay them the salary, and the government is paying the salary, making sure that people are getting paid. They're still in their normal wage, whatever they are earning before they leave. And then you now bring that to the restriction. They identified the areas that are hotspots, and it was divided into a red zone and a green zone. In the red zone, they isolate them there. They cannot travel more than 5 kilometer radius around where they live. And it's so easy to do that people cannot even flout the order. There is a police everywhere. There is heavy fine. If you move beyond your zone, you get a fine $1,500 on the spot. And you can imagine when you cop that fine twice, you will be forced to comply with the rules. They restrict people gathering in larger number in houses. You cannot invite any non-members of your house into your house. And the police are doing a spot check at every interval. And even your neighbors will ring the police and dub you in and let the police know that we're hearing a lot of noise in next door. And the police will come around and they'll find everybody in there. By the time they meet maybe 10, 15 of you in a house and they find you 1,500 each. Next time you will not do that. And when you now bring it into the hospital setting, it was really so managed that there is every hospital, there is just only one entry. Nobody comes into the hospital without being checked. You have your screening, you have the temperature check on either the staff or the patient that comes into the hospital. Everybody gets checked before they enter into the hospital setting, and this check happens 24/7. If you come into the hospital at 2 a.m. in the morning, you will still find people there that will check you and give you a tag and allow you to go into the hospital. And the government developed an app. They called it a COVID app, which once you download the app on your phone, you just need to have the Bluetooth of your phone on. If there is any outbreak anywhere, they were able to track everybody that have had contact to that person that has the outbreak, because it's going to pick a Bluetooth sensor wherever you go, and you can just ring you and said, look, where you've been in so place, we can pick your Bluetooth app there, and they will tell you to self-isolate, that there's been someone that been confirmed COVID positive places where you've been. So that is being managed. And when you now come into the health setting, people that work within the health industry, they have to give us a special consideration. When you come down with a symptom or you have a contact with a COVID positive person, when you don't have the proper protective gear on, you get tested and your result comes back within 5 hours. Even though the other people, their result might not be back until after 2 days, but they prioritize people in the health setting. Your result is back within 5 hours. And then while you are waiting the result, they take you off the line. They take you off the line until yeah.
So good, thank you. I know you have so much information, but we still have two other key professionals too that we want to hear from. You have given us loads and loads of information. Thank you so much. Please just still hold the thought, because we're still coming back to you with lots of questions. But what I have heard you said is the fact that the second wave is real. One.
Yep.
But then there are also measures that had been put in place to ensure that people stay safe which even with the increase, I hear you say the number of deaths has gone to about 909,000, which is quite
909,
significant.
909, not 9,000.
Okay, 909 now. Okay.
Yeah.
All right. So that's also significant. And then people also take responsibility. And so when there are noises or anything that makes people to violate, you can also tell on your neighbor. So that ensures that everybody stay protected and safe.
Yeah.
I've heard you say that. So thank you. We'll still come back to you. Dr. Okwawoye is here on the line. Dr. Okwawoye, can I hear you, please? All right, just click the unmute link that has been sent to you.
Okay.
Dr.
Hello.
Okwawoye?
Yes.
All right.
Yeah.
Yes. Over to you, sir. Let's hear your thoughts on what
Hello?
COVID is. And yes, we are hearing you. Hello? All right. All right. So please go on, sir.
Hello?
We can hear you, Dr. Okwawoye. Please go on. Go ahead.
Hello?
Bye-bye. Sorry, this is technology. This is part of what our world has changed into. So please just bear with us. Dr. Okwawoye, we can hear you. We are hearing your voice here. I think it's just network from his hand. We're so sorry about that. I think it's even frozen now. Dr. Charles Ume, I hope you're here and ready. I want to apologize for these technicalities. It's just something beyond our control. And part of the message we sent out on Yaba Voice yesterday is the fact that we have to just focus on the things that we can control. So we'll just do our beats and just allow the others to stay by. All right, Dr. Charles Ume, are you here?
Yes, I'm here.
All right, so we're going to take you now, and then maybe we'll still be able to come back to Dr. Okwawoye subsequently. Yes, you had worked with COVID-19. I know that you worked with quite a lot of other infectious cases, but significantly, what had been your experiences working with COVID-19, both patients, even both health workers, people who were on the front line, and then what psychological tips do you think will be applicable to us even in times like this? Let's hear from you, sir.
Okay, thank you, Kemi, for this opportunity and for the MD for inviting me. I'm also using this opportunity to thank the Yaba Voice for the good work people are doing and informing people on the current pandemic we are in, especially with the upsurge and the second wave issues. Now, if I go back a bit to history, studies prove that previous infectious disease caused long-term and persistent psychopathological consequences to the society. For example, during and after the severe acute respiratory syndrome outbreak in 2003, a lot of mental health issues as psychological consequences were reported across board, most especially among healthcare providers or frontline healthcare professionals. Factors such as anxiety, post-traumatic stress disorder were identified. This was also the same during the Middle East respiratory syndrome outbreak. And similar symptoms of anxiety, fear, panic were also reported. And that is not too far away from what was experienced during the COVID pandemic of 2019. Now, going by my experience, especially with the COVID issue, fortunately or unfortunately, I was one of the first persons that had contact with in this case. We all remembered when they said he was having depression, he was trying to run away. So that called for me to have an interaction with a colleague with him. And it dawned on us that he was having adjustment issues. And that is part of the experience people who come down with this virus has. And if we look at the onset of this virus, people were thrown into the dark world of uncertainty because nobody understood the nature of this virus. And the information, the treatment guidelines were not there. And it took intervention for people to begin to come up with different guidelines based on what is available to us. And you could also remember that during this period, there was so many information regarding this, thereby causing fear and anxiety to the populace. Now, in order to stem this virus from spreading so wide, the government of several countries imposed certain procedures or guidelines that triggered even more psychological problems. For instance, we knew how most states were locked down. We knew how social distancing came to be. And you know that human beings are social animals. When you stop them from interacting, it's going to cause a lot of emotional problems. And that was what we faced during this period. Now, schools were shut down. The impact to individuals, families, emotionally became very wide because it led to so many psychological problems, which I might not want to go into detail because I have very limited time. My focus today is on the frontline healthcare professionals that were really impacted by this lockdown. Remember, I said earlier that there were no proper treatment guideline. There were not enough information for this. Meanwhile, the cases were on the rise. That was the first phase. Now, this second wave has even brought more issues in terms of the rate of death and the number of patients or the spread getting more and more. Now, what happens to the frontliners emotionally, psychologically at this stage? All right. And if you remember, during the first phase, we had a lot of issues coming from not knowing what to do or no proper guideline. Then the issue of increased workload, okay, brought about so many issues like emotional exhaustion, anger, irritability, especially when you don't have the resources to work with. We know the shortage of PPE, all these things, and then not knowing exactly what to do based on the treatment guideline. This led to what we might consider burnout. But the component of burnout most workers experience that we have to manage them were emotional exhaustion. Okay, and some of them also suffer from depersonalization. Apart from what we talked about, pathophobia, that is fear of contracting the virus and infecting your family with it. These were all rife among the healthcare providers. Now, with increased number of cases and the increased number of deaths due to the second wave, the stress level is now on the high. Now, anxiety level is now on the high among these healthcare providers. Suspicion, avoidance, and probably the uncertainty and powerlessness due to what is expected from the government to deal with this issue and the shortage of all the necessary manpowers to deal with increasing brings much, especially to the level of burnout, these healthcare workers experience. Now, I can go on and on, relaying some of the negative consequences of this increased rate in the virus impact. But how can we deal with some of these things, especially the stress level, the anxiety, the emotional exhaustion that is associated with burnout? Now, let's go back to our experience during the first phase, where we have to manage a lot of healthcare providers in our psychosocial support team. Now, we organize sessions like debriefing session, where they have to come together, talk about their experiences. Now, remember, part of those experiences were trauma-based. They are still a patient you are managing or talking with today, the next moment the patient is gone. Compassion fatigue were there. Then we have to create a forum where they have to ventilate, talk about those experiences, talk about the difficulties they had, okay? And now, apart from that, remember the tension that comes with anxiety, we have to organize relaxation exercises because we know that tension and relaxation cannot co-occur. They can happen together. And there are so many ways people can relax under a tense atmosphere, which are very practical to us. For instance, deep breathing exercises can go a long way in helping people who are under this level of tension to relax, especially when they're going through acute stress disorder. Now, apart from that, there are so many other ways these people who are frontliners can relax. One of them is like creating opportunity for them to go on break. While they are on this break, they engage in activities that relax them and take their mind away from the tension they have in the field. Simple things like dancing, exercises can go a long way in helping. In some other cases, when the level of distress is high, there is need for you to see, or for them to see, a clinical psychologist, okay, for a debriefing session or for a desensitization program. Now, we also talked about technical treatment approaches like cognitive behavioral therapy that can be employed, because most of what causes this problem is our interpretation of the situation. Because in as much as so many people will be affected by the same situation, some other persons might tend to cope better than others. And that is where, apart from CBT, we bring into bear the personality characteristics of some of these healthcare workers. Are you in the right profession? Because some people who cope better with this kind of health distress or crisis are people who have some attributes of resilience, people who are altruistic, okay, who have compassion for other persons. It doesn't matter whether their life is at stake. But I'm not saying that people should throw their life to the gallows in order to save somebody's life. And that is where the professional competency of healthcare providers come in. And it can go a long way in helping them deal with the situation. How does that work? Training and retraining. Like when we started initially, it was difficult maintaining contact with anybody because there were information that the virus flies in the air and people can easily get it from contacts, until we started understanding the modus operandi of this virus, that it cannot travel, it can only get in the air and it's suspended, and it cannot go beyond 2 meters from a distance. And I guess that was what helped me and my colleague when we made the index case, because we have to see him in the open, and we maintain 6 feet distance during the interaction. And good enough, we never get infected by it. So when you have the right information, it goes a long way in reducing the tension that will come from the condition. And as healthcare providers, it's of utmost importance that we be updated every time as the situation changes, because it can go a long way in reducing the panic and tension that can come. I can see Kemi is willing to stop me. All right,
thank you so much. I know you can go on and on and on and on, but thank you so much for that information. You know, you said something very vital now. When the information came that it was just in the air, that was when real panic started for quite a lot of us, because we felt that means we can't even go out, we can't. But at a point in time when we now got right information that yes, it's not in the air, and when you use your mask, you say 2 meters away from people, then the chances of contracting it is limited. And you know, that also gave us the confidence and the boldness to be able to just move out and deal with what we had to deal with. Thank you so much. We're going to come back to you, because before we go, I want us to be able to give the general populace out there too what they can do, especially with the second wave. What can they do? How can they better manage themselves psychologically? So we'll come back to ask you that. But let's see if Dr. Power, are you back now?
Yes, I am back.
All right, good. All right, so let's hear from Dr. Power. We have questions on the chat box. We will take them. Please, let's leave our comments and questions there. But let's hear from Dr. Power. Please, over to you, sir.
Okay, thank you very much. So sorry for the technical issues we've been having. Right now, the isolation ward, I'm just about to go to the ICU to see some patients. So we are in the front of the front line, not just the front lines, we're at the front. And in the very front, we bear the brunt of this virus. And Dr. Ume has alluded to so many things. It's actually taking its toll on us. I have some of my coworkers who are sick with the virus. Some of them, even their families are also sick. And so it's not as if we are supermen or we are superheroes. We are just trying to do it because somebody has to do the job. So this is something people out there need to understand. It's not easy on us, but we have to work for you. So please, any way you can help us, we'll appreciate that. So thank you very much. I give it up to the people who have spoken ahead of me. Mr. Tasso Gutadi, all the way from Australia. Thank you for sharing your Australian experience. And also to Dr. Charles, who worked with closely. And we can all tell you stories of what we are still with COVID. Basically, over the next very short time, really, I was talking about what COVID is all about. So it's a virus, SARS-CoV-2. And it was called COVID-19 because it was first discovered in December 2019. So the virus is just about a year old now, but it has been very devastating. As of today, we discussed almost 100 million cases worldwide with more than 2 million deaths. And in Nigeria, we have about 112,000 cases as of yesterday night. I always tell people that the true number of infections in Nigeria may actually be 10 times that number because a lot of people are not tested. And so we don't really have a true picture. Also, that the number of deaths in Nigeria is actually maybe quite higher than what has been recorded. So it's a virus. And it's very, very important for us to understand how the virus spreads. How do you spread? How does COVID spread? So it spreads from one person to another. When you, it's in the respiratory droplets. And so when you cough, talk, or sneeze, it moves. And then it goes out through those droplets, which many of them times you cannot see them, and then gets on another person when the person inhales. And that's the whole science behind the use of masks. And that's where wearing masks is extremely important in trying to curb the spread of COVID-19, because when you wear the mask, you block your droplets from coming out, and also the other person's all droplets also staying. So that's why that's very, very crucial. So what are the signs and symptoms of COVID? So that's the challenge now with COVID, right? It looks a lot like malaria sometimes because a lot of patients will start with fever. So they will have fever. You could have, some patients will have headaches. Some will have a cough. Some will have sore throat. Some will have runny nose. Some would have loss of smell and loss of taste or alteration in taste. I like the loss of smell because not many conditions present like that. So I tell people, anytime you have loss of smell, don't bother. Don't go to the lab. Just go and admit yourself in the isolation center or go and isolate yourself at home because you definitely most likely have COVID. I've had patients who discovered they have lost their sense of smell when they are in the toilet. And, they just cannot smell anything. Or when they apply perfume, or some people in the kitchen. Some people, their taste goes away totally. They can't taste food, tastes like sawdust. Or food tastes like, like some people, they just have bitter taste, or everything will just become salt. That's how they start suspecting that they have COVID. The ones that are serious are the ones that have difficulty in breathing. And the problem with COVID is that the difficulty in breathing may not be that apparent. It may just be looking like there's nothing going on, and then the thing has gone far inside the body, for the people that have difficulty in breathing. So some people too are asymptomatic. They don't have any symptoms at all. It's only when you go to the lab to test that you find it. The challenge is that even those that are asymptomatic can still spread the virus. It's not as effective as others. And that is why everybody has to be careful. So, difficulty in breathing, and that's all. For some other people, they'll be very, very sick. The challenge in COVID, ladies and gentlemen, is that there is no reliable way to know the person that will be very sick.
Oh, the network is Dr.
And the person that will be mad.
Okay, you're back.
So I've lost a 37. Last week, I've lost a 37-year-old. I've lost two 38-year-olds. I've lost a 29-year-old lady who was pregnant. I've also lost 82-year-olds, 83-year-olds, So there's no way to predict. The reality is that some people will be very sick and some people will be fine. I've treated a 91-year-old woman who did not have any symptoms. And I've lost a 19-year-old girl from this same COVID. So that is why we all have to be very, very careful. And that is why we talk about wearing masks. Unfortunately, a lot of people are not very good with the way they wear their masks. You know, they wear it over their nose, or they wear it and bring it to their chin, and all sorts of things. I think that when you wear your mask, you must make sure that your nose and your mouth are covered like this. You understand? You're supposed to wear a mask like this. Okay? And some people wear it like this. Leaving the whole space here. Or for some people, they make it here. Or some people, they put it like this. I have seen people do this. And the ones we don't understand, they do this. All these are not ways not wear the mask. And when you do things, they don't help in the control of COVID-19. COVID is very, very serious. And the second way is worse than the first one. Now we have people who are very sick. Sometimes we have entire families of isolation. We have had families where the husband died or the wife is very sick. We have some families, everybody is sick. And so we have to all take responsibility in slowing down and try to stop this. Otherwise, if we are not careful, we are going to get to the state they are outside the country. In the US, 3,000 people are dying every day. That is a lot. And health systems are getting overwhelmed. There's no oxygen. I tell you, there's no oxygen. Healthcare workers are tired. Everybody's just trying to find. And we all have to take responsibility and try to do what we can to stop all this virus. I think I'm going to stop here so that because I know we don't have. I think I'm going to stop here. I know we don't have so much time, so I think I'll leave this now so that.
All right, we're sorry, Dr. Power's audio wasn't very good, but then if you listen to him, he was able to tell us the fact that, yes, one of the most important symptoms you will see is headache, sore throat, loss of smell. That's what it is for a lot of people. And that is one of the distinguishing factor or symptoms that helps you to know that, yes, this is COVID. From what he said once that occurred, then know that no doubt about it, you're talking about the COVID, and then it also comes with breathlessness, difficulty in breathing. But he also has said that there are some people too that doesn't even have symptoms. He had said he saw or managed a woman who was 91 years old and who didn't have a symptom. She was asymptomatic, and a girl of 19 who also came down with this illness and died as a result of it. And he also showed us how to use the mask, not under the chin, not above the head. No, a proper way is like this. He was able to demonstrate that to us. We're sorry about the quality of the audio. This is part of what our new world now entails. Sometimes we just get it right totally. Sometimes it's not as good and clear as we want, but we will all just try to manage this and evolve with it until we get it better, and then we're able to do so well with it. Thank you so much, Dr. Power. But I don't know if you're still here, so that you could quickly take one or two questions that had been sent, and then so that we can now release you. Dr. Power, are you still here?
Yes, I am. I'm with you.
All right.
Hope the audio is better. Apologies for that.
Yes. Okay, it's better now. Somebody just asked that why the increase in the rate of death because of the second wave. Is it because people are not implementing the control, the NDCC guidelines? Is that the reason why we have quite a lot of death now in the country? Is that why this is the situation now? So can you just briefly just tell us why the increase in the number of deaths now? Because what we have heard is that the second wave seems to be more severe than the first. Over to you, sir.
Thank you very much. So what we are seeing in the hospital is that there are two things basically. One is that people are getting sicker than the first wave, and people are getting sicker, and I think there are also more infections. So in the first wave, we are admitting everybody, regardless of whether you were sick or not. So there were times we had up to 90 patients on admission. But out of the 90 patients, more than 40, 50 of them were fine. They were just admitted because we wanted to prevent them from spreading the virus. But now we have 10 patients. Those are 10 very sick patients. We are using sometimes up to 60 cylinders of oxygen every day. So what is going on now is that we believe that, number one, the virus is a bit deadlier than the first one. Number two is that we have more people. The reality is that when you have a lot of cases, whether you like it or not, some people will fall through the cracks. And so we have a lot of cases. The hospitals are overwhelmed. Some people spend the whole day roaming around Lagos looking for somewhere to be admitted because there is no space. When that happens, somebody that's supposed to be admitted at 2 p.m. ends up getting admitted at 11 o'clock. Whether you like it or not, the time has gone. A lot of things will happen. That patient may not make it. So the virus is actually, we believe the virus is deadlier. We know there's a deadly strain from the UK, the B117 strain, and we are sure that probably we have that strain too here. So we are seeing people sicker. A lot of people are also recovering, though, but a lot of people are also dying. Thank you.
Thank you so much. But there's this new thing that is going on. I'm still going to take you. I know you have to go to the isolation ward. About steaming and every other thing now. In the recent, let's 2 weeks of steaming, 2 weeks of steaming. Does that help? People have gone on garlic. People have gone on ginger. It has even made ginger and garlic to be expensive. What's your view about that?
You know, when issues like this happen, you can be sure that everybody will try and do what they can do. You know, there's a lot of panic out there. The challenge is that, some things are harmless, more or less, and ineffective. Some things are ineffective, but they are harmful. Those are the ones I'm worried about. Hey, if you want to steam away. But it doesn't work. Let's be clear. You know, my mother would call me from my house. That, you know, if I could speak Yoruba, only koro yìí kò lágbára o, bọ́bá ti mú mi gbóná sí yóò lọ ni. Meaning that coronavirus does not have, it's not powerful. Just drink hot water, it will go. Unfortunately, I have people that will only drink hot water, they will bath with hot water, scan themselves, and then they go under the shower and open their mouth so that all the hot water can go inside in a bid to kill the virus. It will not work. So we have to be careful about a lot of things on social media. I always tell people, I know somebody that was bathing with bleach to kill COVID. All these things does not work. So if you want to steam, you can steam if it makes you feel better. But
you just popped our bubble because we've been steaming for 2 weeks now. We are going to steaming therapy.
Continue steaming. It will give you better skin.
Okay.
So it doesn't work. No.
I don't know, this information that you just gave us now, I don't know, it's just taking our consolation away. But thank you so much.
Yeah, thank you very much, man.
Thank you so much. Honestly, you have enlightened us and you have made it better. But what's your word to the people out there? What would you say would help them to do better before we now go to the psychological part? What medically?
I think so. This is it. What I would tell you, COVID is a very difficult virus to control. That's the truth. The masks help, but the masks don't prevent it 100%. What we try to tell people is that if you don't have to go somewhere, please don't go. Look, I've seen people come in, bringing all the money and saying, don't worry, we'll pay. But you can't pay for what is not available. So I've seen money disgraced in COVID. I've seen power disgraced. People calling from everywhere, trying to get patients admitted, trying to get patients seen. You can't go beyond what the resources are. So don't think that your money or your power will save you if this thing comes. Whatever we can do, let's try and do it. Let's wear our masks. Let's stay safe. Let's keep from going to where we don't need to go. Let's minimize our activities and let us pray that very soon the vaccine will get here and we'll be able to sort ourselves out. But in the meantime, please be careful. The hospital is not a funny place right now. I am telling you. And we all have to be careful and make sure we don't get COVID. This is not a good time to be sick. Thank you very much.
Thank you so much, Dr. Power. That's a very beautiful one. But you know, you just said something now. I have seen money disgraced. I have seen power disgraced. So it's not a function of, I have money or I'm in high position, I can deal with this. And so please, what we are talking about is real. And that's why we had brought key experts who are working directly with these people here today so that we can be better informed to manage our life. Dr. Charles Ume, let's go to you now. I will still talk about the children. Oh, that's a beautiful one. My children has not returned back to school. We will talk about that soon. Dr. Charles Zume, please, what are the psychological tips? Dr. Power has given us the medical. What are the psychological tips that we can put in place for the common man, not just the health professional now, the common man out there? What can we do? Actually, the fear is real. Our children has not gone back. I've not allowed mine to go back. That's the truth. They resumed on Monday, but they've not gone. And I don't know if they're going this week. So what can we do?
Okay, thank you very much, Kemi. Now, you and the situation.
Dr. Charles, your audio
We
is not so clear.
know what this COVID is, because if you go around, believe there is COVID.
Dr. Charles, your audio, you're fluctuating, sir. Okay, Mr. Ogutade. Mr. Ogutade, please unmute Mr. Ogutade. We are sorry for, this is not within our control.
Yeah, that's
okay.
all right.
All right. Okay, so Mr. Ogutade, what's your word on how people can stay safe with all that is going on? Like I said, my children hasn't gone back to school. So what's your word to us, everybody out there, especially here in Nigeria?
Okay, very very good question. Something that first thing that I will suggest is that we all need to adhere to the universal precaution, like social distancing, wearing a mask, maintaining a proper hygiene, making sure that we wash our hands regularly, keep away from where we don't necessarily need to go, only do what is important. And when, like the last speaker said, not just wearing the mask, we need to wear the mask properly, because there is no point in putting covering our nose with a mask, and we're just wasting our time, preventing ourselves fresh air here when we're not doing it in the proper way. And more importantly, something that I would like to talk about is the self-care itself. Self-care is very, very important, not only just for healthcare provider, I think for the general public, and it will help us psychologically a lot. We need to get a break from the overwhelming information we persistently receive every day on social media, on everywhere. And we just need to reduce that exacerbation, which can lead to some anxiety issues and just spiral into a negative thought. Take time to exercise. Look for something that is more important to you, and find time to unwind. Focus on ourselves as a priority instead of thinking of what could have happened and what could have been. We should also focus on the present. You can't control what is going to happen tomorrow. Just remain in the present and see how you can walk through that present moment. And this many of these will make a little brighter day for us, you know. And within ourselves, peer support is very important. We can encourage ourselves. We can give our colleagues support. And you don't really need to go into telling gory stories about somebody that died or somebody that couldn't find an oxygen. We don't need to go into that. And assuring our colleague, telling them their feeling is normal, that there will be anxiety, there will be all that. And we don't need to be non-judgmental about the issues that happen or feeling negative all the time. And and supporting a safe work environment is very important, and we can all contribute to this. This is not a job of the organization alone. The medical director is not the one that is going to create a safe work environment alone. It has to be the responsibility of everyone. If you see something going, if you see something, say something. If your colleague is doing something wrong, there is no reason why you shouldn't correct them. Say, no, don't do it that way, because COVID is a leveler. COVID doesn't have what the previous speaker says. COVID doesn't respect anyone. It normalizes everything. If you're rich, if you're poor, if you this, you can help the situation. So please, it's very important that we do practice a safer practice and provide appropriate information, share only appropriate information across our colleagues and even to the people that we look after within the community.
All right, thank you so much, Mr. Charles Okuntade. What I've heard him say is the fact that we don't have to exacerbate the fear. We don't need to increase it. Let's focus on the present. Let's not begin to look at or borrow tomorrow as a problem, but let's also visit sites where you can get adequate and correct information that would help you so that we know what's going on and then we keep at it. And if we know that, yes, if even if visiting those sites will create fear in you, please then walk away from there. You can have time scheduled when you would go and visit those sites and get the information you need, and then you shut down. You don't need to follow all the news all the time, because that might also increase your fear and your level of anxiety. And he has also said self-care is important in all of these things. Let's focus on ourselves. Let's take care of ourselves so that we can be healthy, even for the old ones too. Yes, even when they say underlining and every other thing, Dr. Power has told us in 91 years was able to make it, and he or she is still alive, doing well today. I don't know if Dr. Charles Omel is back. Dr. Charles, are you back?
Yes, I'm back. Can you hear me now?
Right, so yeah, we can, sir. Let's have the psychological tips from your hand, sir.
It's okay. And part of what Mr. Charles said is pretty important to the psychological well-being of the general populace. That is the kind of information you have about this COVID. Now, there are so many things you can see in the internet, and that is what was triggering the anxiety and fear ab initio. And most of those things were inspired guesses. They were not the true situation. So if you have to visit only the site, we have WHO sites, we have NCDC sites where you can know the real information about COVID. Now, the other aspect of it is this, which we've not been able to deal with due to time. That is the need to improve our body immunity. And we know that stress is one of the factors that deplete your immunity. And we are stressed every day, living in Lagos alone, okay? Now, the first thing to that is identifying your stressors. By the time you identify your stressors, you manage your stressors, okay? And there are so many ways you can do this, which time might not permit me to go into. But the first thing is learn how to tame the demon in you that manifests as anger and aggression. It depletes your body immunity. The next one is the work overload. How many of us are beating much more than we can chew? Learn to prioritize. These are what I have to do. These are what I need to do. Don't put all your fingers in the mouth at the same time, because it's only when you're alive today that they can function. Now, I also want us to develop a healthy habit in terms of exercises. 30 minutes a day, organized physical exercise can go a long way. It might not necessarily be jogging. You can stay in your room and dance for 30 minutes and forget your sorrows before you have your shower and go to work. That will go a long way in helping you. And another one that people tend to ignore, which we consider in positive psychology, is how do you address your colleagues? Anybody you see, if you say well to anybody, you're enriching your soul as well. When you see anybody, please feel free to acknowledge the person pretty well. By the time you do it to 10 persons, it has enlivened your mood for the day. And I don't think the stress will hit you that much. There are several methods we can cope with the pandemic. So those are just the little things.
Thank you so much. You know, I love the fact that you said just tame the demon within. And you don't know that, as a matter of fact, there are lots of people going around with so much anger and aggression now. the level of anger and aggression out there is so much. You know, people will just come at you for no reason. You will think you are the one that asked COVID to come to Nigeria. And, you know, they're just passing on their frustration. And if you're not careful enough, you will pick up the frustration that they had passed on you and you pass it on to the other. And then it becomes a chain of reaction that you may not be able to manage. Please, let's just look at all of these presenters have told us today, and let's learn how to safeguard ourselves. One major fact that we're going to take away from here is the fact that the second wave is real. Nobody is trying to cajole or make a name out of this. Dr. Power said, I have seen money disgrace. I have seen power disgrace. And that's the fact, and that's the truth. Yes, again, quite a lot of things are not so going on right, even in our country, we know that. But everyone has to take a responsibility for themselves. If the government is not providing the facility, if the organization is not providing the resources that you need, please do as much as for yourself to make sure that you take care of yourself. Do what you can within your own power to safeguard yourself, to ensure that, yes, you are protected from all of these things. And we don't want to go into the issue of the vaccine. We may come back sometimes later to talk about this. But what we just want to focus on today is about the frontline workers, what the experiences have been, and what the psychological tips are. Sometimes later in the course of the year, we will still talk about the vaccine, and when we have all the information that we need, and then we have key experts that will talk to us about it. But I want to say thank you so much, Dennis, and quite a lot of other things. Mama Shinawa, quite a lot of people are here on this call, people that had come in repeatedly and to just join us. Basharundo Jadewolu, honestly, we just appreciate you. And we'll keep saying thank you for being a part of it. But please, to make this wonderful for us in Yaba Voice, always like and share our pages. We are on Facebook, we're on Twitter, we're on Instagram. Any comment, anything from Yaba Voice, just please share, like, make comment. That makes us more visible to people and allows a lot of people also to benefit from us. Next month, by the grace of God, we'll also be looking at the issue of emotional health of the child, how to do identification, and what are those things that we need to do, because all of these things that we're talking about too, it's affecting them. There's a change in the world that is also taking a toll on these children. And so we must be able to learn how to manage them and how to better safeguard the life of our children. I don't know if my medical director has a last word for us. The medical director, the last word, ma'am.
Thank you very much, Femi, for being a very good moderator. And permits me to still thank Basharundo Adewolu. Thank you, Baba, for being here. Thank you for the support. Professor Eileen, Mrs. Lati Sema, thank you. And everybody that is present here, those who can see and those who do not see. Thank you for the support you are giving to Yaba Voice. Thank you very much. Next month promises to be another day when we'll be talking about the emotions of the child. Thank you so much.
Thank you so much once again for being part of this program. Please always just send out information about this to anyone anytime. We have a video online currently now, and that video is more about the COVID-19 and people's reaction. Please just share, let people benefit. That's what we're trying to do here. Until we come your way again next time, please stay safe, use your nose mask correctly, and do all that is in your power to ensure that we live a healthy life this year. Take care. Bye-bye. Thanks to our presenter. Bye.